Hi, my name is Mohammed. I am working in Blue Ember Studios, and today I will explain to you about our application, MediVault, and how we are planning and designing our reseller program that we want to use to promote this solution in different countries in the world. So first about us, we are Blue Ember Studios. We are an IT company based in Emirates, United Arab Emirates. Our solutions actually aim to the betterment of human lives, and that's why we are focusing on medical and social applications predominantly. So the problem that we are trying to solve with MediVault is that doctors are overloaded. They have a lot of work, they have a lot of patients, number of patients is increasing of all ages. It makes the healthcare delivery quite complicated, and patients are very demanding. So they demand the doctor's attention and the doctor's knowledge of them, and he has to remember all their history. So they expect him to know them very well, and they also expect him to give them all the time they need, even though he is overloaded and he has too much work and too many patients to deal with. On the other hand, patients are disorganized, so they go to many hospitals, to many clinics, to many laboratories, to many radiology centers, and they collect a lot of data, images, lab results, blood measurements, urine measurements, and. So the amount of information is a lot, and it's increasing. And if they have to do this not only for themselves but for their families, it becomes really a lot. And that's why a lot of information gets lost. They forget to bring them with them. They don't know where they put it, and then the medical information is lost. And the result of this is that the doctor wastes a lot of time asking them the same questions over and over, asking for critical information which he cannot get from them because they forgot it or lost it, or they can give information but they give the wrong information. So in any way, the final outcome is that the patient receives suboptimal healthcare service from this doctor. So what we want to do is actually to connect the patient and the doctor. And the way we do it is that we use an application, MediVault, the one we invented, and we use it to acquire the medical information from the patient, whether it's lab reports, radiology reports, prescriptions, vaccination history, chronic disease data, diet and weight loss, and all these things. And if there are reports, we can help him using OCR to extract the data automatically and store it for him. He doesn't need to type it all the time. So we take this information from the patient, we organize it in a readable way. The curves are very important when we are talking about any lab results analysis. So we provide it to the user and the doctor in a very organized way, and something that's easy to see and analyze. Then we pass this information to the doctor, so the doctor gets very easily all the information he needs, all the lab measurements, all the parameters. He gets it in the form of a nice curve. He gets to see the radiology images and the radiology reports. He gets to know the medication which the patient used and how many times, and so on and so forth. So the whole medical history of the patient becomes accessible to the doctor, and this means that the doctor has all the information he needs to make some sound decisions to help this patient. So in addition to this app, which is in the hands of the patient, we provide the doctor with a complete solution for managing his clinic. So not only to view the data which the patient shared with him, but also to manage his appointments, his staff, his online booking. He can have video consultation through our solution, and he can connect to his patients as well, of course. So all those things will be available to the doctor. If the doctor works in multiple clinics and he wants to manage his appointments in all those clinics, he can do that very easily. So it's really a very nice clinic management and appointment management solution, which is given to the doctor to use for himself. So what you're actually selling the customer, your doctor, is not just a new IT solution. You're helping him modernize his clinic and become a member of a very, very big society, which we are building in every country now. So, how to sell MediVault to doctors? The main idea here is that we really have to start in the correct way and then take it step by step. So first, we don't go and show the doctor the application and talk about it. We talk to him about his problems. What are his pain points? So just have a chit chat with the doctor. Do your patients bring their data with them? Do they really have everything in hand? Do you have to repeat lab results because you don't see the result which they got from the other laboratory? Can your patients make online booking with you? Can your patients have a video conference with you? All those things are just opening questions. Let the doctor talk, let him tell you about his problems, and then you start to introduce MediVault. If the doctor really is suffering from the fact that his patients are messy, you tell him this will help you get organized data from your patients. If the appointment booking in his clinic is not so easy, then we can offer him online booking. If he would like to have video consultation with his patients, we can provide the solution. So all those problems that we solve, if you hear the doctor correctly, you can tell him how our solution helps with that. So as a closing, it's very simple. Tell him, try it for 1 month. There are no obligations. If you don't like it, you can stop at any time. And he can freely add his patients to this platform and use it. If he likes it, it's good. It's free for the first starting period, and he doesn't have any expenses or headaches involved. So the question is, how do we make money? How do you make money? So first, to help you understand how we make money as Blue Amber Studios, first from the patient, we advertise on the application itself. So through Google Ads, we make some money. And if the patient decides to subscribe, because there are some features which are blocked behind premium subscription, if he gets the premium subscription, he will pay us a monthly fee of $1. So these are the two income streams from the patients. From the doctors, if he likes our service, after the initial grace period, he can start to pay subscription. I will tell you a little bit more about this in the next slide. So the nice thing is that if we commit ourselves to get at least 100,000 users in every country, and we are working towards this. So if we don't make it, the doctor doesn't have to pay us any subscription. If he makes up to 100 new patients who subscribe to the app through him, then he doesn't have to pay any subscription. So we try to help the doctors really motivate their patients to download the app and use it more and more. So in our business model, the main source of income is actually the advertisement and subscription from the patient. The subscription from the doctor is a minor side income. So how do you make money as one of our resellers? You get what we thought about is that like the butterfly effect. If you recruit a doctor and the doctor starts to add patients, one of these patients goes to another doctor and he convinces him to use our service, then this doctor joins our network, and then the second doctor brings his patients. So the effect of your work to acquire one doctor doesn't stop at this doctor alone. So our philosophy behind calculating the commission is that we want to give back to our resellers 20% of our total revenue. 20%. How are we going to divide this? We see your doctors, how many patients selected them as their doctor, okay? And then we see the total in your country, how many patients have joined our app and they selected any doctor, not yours, any doctor, okay? Then we count how many you have, how many came from anywhere else, and then we give you 20% against the ratio of your patients against the total patients in your country. So it's really a very fair way of splitting the total revenue that we make in the country, because you contribute directly through your own doctors and your own patients, and indirectly through other people who would be motivated to use the app because of your doctor or your patients. So we think this is a very fair way of splitting the total revenue that we make. And out of your own doctors, if they pay commission, we give you 20% of it. So whatever they pay us, we give you 20% of it. Okay? So a good example for that is let's say we make out of your entire country $100,000. Whether we make it in a month, we want to make it every day, that's impossible, but let's say we make it every quarter, every 3 months. We pay you back your commission every 3 months. So 100,000 we made from your country, from the patients in your country, and the total number of the patients who have selected a doctor in your country is 10,000, and the total numbers who selected your doctors to be their doctors is 1,000. So what you will get is 20% of the 100,000 multiplied by the ratio between your 1,000 and the 10,000 in the total country. So if you do the math, you will get $2,000 out of the 100,000 that we made. The rest of it will be, the rest of the 20% of course will be divided among the people who also helped us get more patients on board. For the subscription from your doctors is much simpler. Whatever subscription we collect from your doctors in every quarter, we give you 20% of it. And of course you will have the reseller platform where you can see all this. You can see how many doctors are acquired totally in your country, how many patients, how much did we earn so far, how much is your commission for this quarter we are in. Okay, so if you sum the two components, you will end up making $3,000 within this period of time. The nice thing about it is that this is a passive income, so it will continue to come to you even after your retirement, as long as our application is up and running and being used. So with this sharing of profit and revenue, we believe that we are opening the door to help you create a passive income that will continue to run even after your retirement. It will keep helping you sustain your life standard, and you don't have to work anymore if you get a certain number of patients, or it can grow by itself automatically. It will really grow, it has potential to grow, and whatever seed you plant with us, it will keep growing and providing nice fruits. Okay, so as I said, you can reach us at any time through email, and I'll be more than happy to jump on a call with you to discuss and answer all your questions. And if you have any suggestions to improve the way we work, please, we are open to that. But let's get started. Let's get your first doctor on board. Let's get your first patients on board, because this is how we are all going to win: the patient, the doctors, we, and yourself, of course. Okay, thank you very much, and I hope you enjoyed this presentation.